Well, it's a way of keeping up to date with what's going on and what is coming in the future. And it's a way of meeting up with people too that have already got it. And sort of finding out what's going on generally and if there's anything you can do to be part of to continue the fundraising. Well, officially I'm only in the atrial fibrillation bit, but they've been great. When I first had AF and they wanted to um, do a node ablation, I didn't, although I was nursing, I didn't know anything about it. I was terrified, and that's when I first got into touch with them. And they were very reassuring, and you just always got someone you could talk to. You could ring them up sort of virtually any time, and there was somebody there, and then they involve you in reassuring other people.
Incredibly. I've been a patient for 7 years. Events like this, I mean, we have the information, we've got the support from both the professionals, but also Trudy and her support there as well. It's incredibly valuable because I think so often we have opportunities to see our GPs and our cardiologists with my condition, for instance, once a year. So these sort of events give us the opportunity to sort of share stories, support each other, and get information like we have done today. Well, my first experience was the patient day about 2 or 3 years ago, and I've been going ever since. I had the opportunity last year to go to one of their pre-events where we spoke to one of the vendors regarding the product. So they wanted a patient's perspective on how we look at it, our experiences with it. So over the last 3 years, my involvement has been sort of very close in terms of we have a good relationship, and I like to be as involved as they can allow me to be.
I've been a member of the Arrhythmia Alliance for the last 20 odd years because both my daughter have different cardiac problems. So my eldest daughter, who's now 23, has vasovagal syncope, and my youngest daughter, who's 16, had SVT. She's since been cured after she had ablation, and they both used to be patients of the Royal Brompton in Kensington. And the Arrhythmia Alliance has basically been our life support for the last 20 years, because when my daughter was initially diagnosed, she was misdiagnosed with epilepsy, and had it not been for Trudy and the Arrhythmia Alliance and all the help and support, we wouldn't have actually got the diagnosis that we have now, and she wouldn't have had the pacemaker that she has now. But I've come back here today because she's reached her 10 years on her battery of a pacemaker. So I've come to talk to all the medical experts here about devices, and I'm so thankful about coming here today because I've learnt so much information, because she does need a new device, and we've got quite a lot of anxiety and worries about the next device and what type of device that she needs. Today I've really enjoyed coming to this event and listening to Trudy speak and to listen to the medical experts speak about the different devices, and also detecting AF as well for older patients. And I'm actually quite surprised with how technology has advanced in the last 10 years with regard to helping patients and carers detecting arrhythmias and AF. And I just feel like we have so much more to learn, and it's by coming to events like this that we as patients and carers learn so much, and then we can take that back and share it with other people as well.